Hello, viewers. At Miracle Integrated Health Center, we get many of the impossible cases. So, in this series, we are going to discuss about few such cases we have encountered, which have been left over by other hospitals. I'm discussing about a case of 48-year-old female. She was diagnosed with a high-grade lymphoma. In fact, her biopsy report, when she has taken elsewhere in her place, it was showing that it is an undifferentiated carcinoma. At Miracle, we don't look for the mutation per se. Like most of us look into the genes and try and put some drugs and try and modulate that mutation and get the patients back to their life. This is a conventional medical oncological approach. At integrative oncology approach, we approach in a different way. This high-grade lymphoma is usually the lymph nodes inside the body which get enlarged and it becomes hypermetabolic, that the cancer cells are present in those cells. This lady, when she came to us, she has having enlarged lymph nodes in her lungs, and she's having enlarged lymph nodes in her bones and as well as in the inguinal region. So she was literally not able to walk. Literally, she was in a stretcher when she came to us. So usually in most of the patients, whenever they come, we look into how their metabolism looks like, because rather than addressing the symptom, that is a genetic change, we want to address the root cause. So when we looked into the metabolic disturbances in this particular patient, what we have found is like, in most of the patients, the first thing which we go and check is their vitamin D levels. In this lady, her vitamin D level was 26.8, which is even though a borderline lesser than the deficiency, but still she's having a deficient vitamin D levels. And alongside, we have checked their parathyroid hormone, ionized calcium, which was again going in the lesser amount. And also when we looked into their ferritin, the iron content is around 1711, that is 1711, which is very higher compared to a normal around 200, 250 is considered as normal. So this basically is showing that on her B12 levels, when we look into, it was more than 2000. And similarly, the CRP, the inflammatory marker level, when we checked, it was 63.9 as against 5, which is a normal limit. So rather than addressing the symptoms, as I told earlier, we tried and targeted this patient's root cause. So we have put her on a combination therapy, what we do over here. So we corrected her metabolic changes by putting high dose vitamin D levels. Then we corrected her tumor microenvironment, that oxygen levels improvement through the ozone therapies. Then we used oncothermia on the lungs as well as the inguinal region as well as the bone regions. We slowly start correcting her. So she came to us in the June of 2025 and undergone treatment for multiple occasions from June till December. She was discharged day before yesterday from our hospital. As now she's able to walk and do her things very well. Only disturbance what she's facing presently is the reduction in the platelet count, which is basically the problem which she encountered post her chemotherapy, which she was doing outside. And we also do a low dose chemotherapy for her as per the advice of our medical oncologist. But the story is that a patient who was given just 3 months to live, who was not able to diagnose properly, who was told that there are no drugs available for her, from a stretcher, she's able to walk. And this is not something like which will be happening to everyone. But the message I want to say through this case, by correcting the metabolism, correcting the diet, the message I want to give to the viewers is like, there is still hope. Drugs are not the end. We can still correct the metabolism and come back to life. So trust in the process, trust the metabolic change which is needed for your body. We can walk back to our life. Good luck.